To senior health representatives of public health, Dr. Teresa Tam and Dr. Howard New, as well as the chair of NACI, Dr. Shelley Deeks. We unfortunately did not receive a response to our invitation, and we are aware that they are all actually now blocking emails. So we do not expect them to join us today. However, we have a momentous occasion, as I've mentioned, with some of the leading experts, subject matter experts in COVID, including immunology, virology, epidemiology, and medicine. So we are going to turn this event into a live Q&A with doctors. As mentioned, Dr. Roger Hodkinson, Dr. Paul Alexander, and Dr. Byron Bridle. This is how today will go. I will call upon doctors one by one to come up and give a short introduction of themselves and their qualifications, followed by a brief overview of some of the science that they will be discussing, about 10 minutes or so. Following that, we will then open the floor for questions from the press. I don't see any mainstream legacy media here, but that's okay because we have lots of folks waiting to ask questions. So if you have questions coming from live streams, we will facilitate those as best possible. Please remember, this is going to be a courteous, respectful event. The intention was to discuss the science pertaining to COVID-19, the declared apparent emergency, and any associated mandates. So I think if there's nothing else from me, I'm going to first welcome Dr. Paul Alexander to start off this event. And again, thank you very much for joining us today.
Thank you guys very much for having me again, and I'll try to be very brief. So I'm going to give my overview of COVID, stretching from the beginning, January, February of 2020, and to today, as the way I see it. It's kind of like a 50,000 foot level view, not too much granularity because, you know, we want to engage everyone quickly, and we have Dr. Hodkinson and Bridle to come. So that's my opening slide. Dr. Paul Alexander, Dr. Bridle, myself. My background training is in epidemiology from the University of Toronto. I also did graduate work at York University. From the epidemiology at UFT, I did a short program at Johns Hopkins cervical program in bioterrorism, biological warfare, how to weaponize pathogen, etc., and how a small city like Baltimore would respond. From there, I went on to Oxford in clinical epidemiology and evidence-based medicine, and I worked under people like Dr. Carl Hennigan, etc. These are the global leaders in EBM. And from there, I went on to McMaster in Hamilton for a doctorate and a postdoc with Dr. Gordon Guyatt, who founded evidence-based medicine with Dr. David Sackett. And Dr. Guyatt and me have remained personal friends. I support his research globally still, everything to do with research methods, randomized trials, meta-analyses, network meta-analyses, systematic reviews, all methods that the global research community, the medical field uses, I'm part of in terms of refining and updating it. So germane to this discussion, because of my background skills, I worked with WHO in 2008 as a regional epidemiologist for Europe, working the countries under me. The desk that I held in Copenhagen was Russia, Ukraine, Turkey, Poland. And from there, I was asked by WHO Pan American Health, Washington, D.C., to develop a training program for low and middle income countries in terms of evidence-based medicine and epidemiology during 2019. When COVID began to rear its head in January, February of 2020, although I would argue, and we have evidence to show that COVID probably was circulating mid-2019, and that's a separate discussion, but WHO asked me to pivot my role as their pandemic advisor for evidence synthesis. So I actually worked as WHO's Pan American Health COVID advisor, all things evidence, at the beginning of this pandemic. Whilst doing that, I got tapped by the Trump administration, White House, to come to Washington to be their senior COVID pandemic advisor based on the skills that I gained at McMaster. So I have to say out of the box that I'm very honored, very privileged as a Canadian citizen. I do have status in the United States, but I'm a Canadian citizen, and I gain a lot of my skills from McMaster University in Oxford, and I wanted to say that here. I'm a personal friend of Dr. Gordon Guy. I have nothing negative to say about McMaster. It is a place that I love and I will always help. So let me move forward. So my first slide, background. I put CBC has lied. We did an interview here following a discussion that we had, another interview, and the CBC interviewer interviewed me and asked me a question. Now, I had conversations with them prior on the phone, and we talked about, what is your view on the response? Many people had died. What do you think should happen to public health officials and stuff? So we had our telephone discussion, but we made arrangements that I'll be interviewed here in person. During the in-person interview, other people taped it, but CBC went on print that I stated that public health officials should be jailed. Now, because of the deaths, we have lost a lot of people across the world, particularly in Canada, because of the lockdown policies and school closures and vaccine and mask mandates, etc. I am on record stating this. I worked in the United States government, and Dr. Fauci and Dr. Birx, their policies killed people. I've been on record stating this, and I'll state it again. But when I was interviewed outside of this room, the interviewer asked me, and I said, well, it's not my position to decide who's to go to jail. That's not my business. But if you ask me, they should be fired. I would fire them all. I would fire everyone in the federal public health response, Tam, Lou, everybody. Fire them, everybody. I would fire everybody who works for Doug Ford and his science table. Complete abject failure, his science table. I'd fire everybody in the Toronto response. And that reporter wrote that I stated that these people should be jailed. So I want to go on record to say that we actually have the video of what I said, and I am putting it up on my Substack. Anyway, first line, COVID amenable to risk stratification. We knew this in January and February of 2020, that COVID was amenable to risk stratification. That meant that your baseline risk, your baseline risk was prognostic on your subsequent mortality or severity of outcome. That meant that the risk that you brought to the table will determine what happens to you with COVID. So we understood, people like Bhattacharya, Kuldoff, Sunitra Gupta, myself, Scott Atlas, we understood that you have a more focused protection where we use an age risk stratified approach to dealing with this pandemic and not carte blanche lockdowns or school closures. We argued with countries, we argued with Canada, we argued with UK, the United States, etc. And I was in the administration. But to no avail, because it was a battle. You saw Trump daily on that platform podium fighting with his own task force as he tried to open his society and open schools, because we were getting the data to show that the lockdowns were killing people. The school closures were killing children. They were causing children to commit suicide. We saw the failures, yet, as you saw, it was almost a clunker daily in the United States government. I was on the back end of it, fighting behind the scenes with Dr. Atlas, and it was not an easy situation. It was actually a horrible situation. Anyway, so I mentioned the age risk stratified approach. Look, January, February of 2020, and now we're in February of 2022. My position remains the same. All we needed to do with this virus was we strongly protect the vulnerable in your society. Double down, triple down protections. We do everything we can in a nursing home, assisted living, your private homes. But we message vitamin D supplementation because of its strong role in cellular immunity, immune response. We message proper body weight control because we found out quite early on that obesity emerged as the superloaded risk factor behind age. So we needed to tell people to get your weight under control. That would have been a very positive step, yet our public health officials squandered 2 years. But the main message has always been, you strongly protect the elderly in your society, and you allow the rest of the society, the young children, the infants, the young persons, the teenagers, the young adults, the middle-aged adults, well, healthy people, you allow them to live largely unfettered lives. You do not lock the society down. You do not close schools. We never should have done this. And that was a catastrophic failure by the federal government of Canada and a catastrophic failure by Doug Ford and the provincial government. At all levels of government, we harmed people with these lockdowns. And we studied it, and we have shown, I have published in AIER, I have published in Brownstone, I've researched with many global scientists, and we've shown that lockdowns killed thousands of people beyond the virus. School closures killed many children. In the United States of America, while I was there, I can tell you, there are things I cannot discuss, but things I can. We were getting reports on a daily basis coming up from the States and winding it up to the Oval. And I can tell you that Trump knew, and that is why you were seeing him. It looked like a clown car show, but he was literally fighting the task force because he knew he was getting reports from the States, from us, that little children 8, 9, 10 years old were found hung in their bedrooms. They committed suicide because of the school closures and lockdowns. This was a real issue. But the media in America, the legacy media, decided that they will hide that information from the public because Trump was ramping up the election year. And if they reported the actual data of what was happening to children, then Trump would look good. So they decided that they would lock it out. But we were seeing the data. So behind the scenes, there was this vicious fight with Dr. Atlas and the task force, myself and Fauci. It is well documented, and well, as I said, it was a horrible event for me. Anyway, Dr. Donald Henderson, who eradicated smallpox, those of you who would know, in the 1970s, etc., he wrote a seminal paper in 2006 where it surrounded pandemic preparedness. I actually got to know Dr. Henderson personally because when I did that biological warfare program at Johns Hopkins, it was his program, and I met him and I talked to him about probably doing my doctorate with him, and he agreed, but I decided to go with Dr. Guyot in Canada. But these statements by Dr. Donald Henderson, written in 2006, remain seminal and key today, and they're as follows. And this is what I mean by we should have never locked this society down. Experience has shown that communities faced with epidemics or other adverse events respond best and with the least anxiety when the normal social functioning of the community is least disrupted. Strong political and public health leadership to provide reassurance and to ensure that needed medical care services are provided are critical elements. If either is seen to be less than optimal, a manageable epidemic could move toward catastrophe. And that is what we had in Canada. We had catastrophe by Theresa Tam and Howard New. And we had devastation by Doug Ford and his COVID team. It was utter failure. Now, quickly, what did we find over the 2 years in US, Canada, UK, Australia, etc.? Well, as I said, I did the research with many scientists globally, and we've published all of these different papers. Now, these are actual hardcore scientific papers, but the medical research community decided to dox us and cancel us. They will not let us publish in peer review. So I decided as a lead scientist that we will publish as op-eds. So we've been publishing in AIER, Brownstone, everywhere that would take it. And we've published on the catastrophic effects of the lockdowns. We've looked at all of the science, and we could find not one society in this world, not one country, not one setting where any lockdown worked to curb transmission or reduce the risk of death. We looked at masking. I can tell you, I've studied masking up and down. I'm considered an expert on these COVID masks, the blue surgical masks and the white masks. They are utter garbage. They have always been ineffective. These blue surgical masks and white masks have never worked, never. And they're actually very toxic, the chemicals in them, toxic to our children. So I'm telling you, this is my scientific view. but these are papers published. These are published papers that I've put together. Let me just say no here. Good. In terms of school closures, we looked at all of the science in every country in this world, and there's not one location, no country, no setting, no state, nothing, no province, where school closures work to curb transmission. In fact, we've shown that the school closures harmed children, devastatingly harmed children, because children committed suicide because of these school closures. School closures that happened right here in Ontario. We looked at, I recently published, well, it says 400, but it's now 500 papers we've pulled together for the Brownstone to look at everything. Lockdown, school closures, shelter in place, every policy. And we have shown in not one example, not one, did any of these policies work. In fact, Johns Hopkins recently published last week a seminal paper where they have now decided to study, and they show that lockdowns failed, complete failure. And they're actually 1 year too late because we had already published science. I also recently published again on the masks. I looked at 150 studies that showed that the masks are worthless. They're ineffective. They just do not work, period. There's no ifs, ands, or buts. There are two RCTs on deck. One is the Danish mask study. That shows that there's no difference between mask or unmask. And there's the one that's the cluster randomized in Bangladesh. That study drifts between zero effectiveness to about a very modest 12 to 13% reduction. But we have serious concerns with the methodology, so we don't take that RCT seriously. This one I highlighted here, the attack on scientific dissent. As you know, Dr. Brittle here is one of the people in Canada who came forward with the science to show us a real clarion call, and I think one day he should get the Nobel Prize, because it was his work that showed us the damage to the vasculature, to the endothelial layer of the vasculature in the human population, using the animal model, but also we had human research to show that the spike protein that our body produces as a response to the vaccine is an actual endothelial pathogen and damages the vasculature of the heart. And his work with Dr. Patrick Whelan was seminal work, and actually clued the rest of the world into the situation with these vaccines, because COVID has emerged to us as less of a respiratory illness. COVID has become clearer to us now that it is a vascular illness. It is a disease of the vasculature, and often the desaturation and the breathing difficulties that people experience is due to the we have these massive number of microthrombi, blood clots, that manifest across the body due to the vaccine, due to the infection, also the natural infection. But the vaccine mirrors the pathology from the natural infection, and that is why we question, why would you make a vaccine that is delivering a payload that is as devastating as the actual infection? Anyway, so my view, the Liberal government, the Right Honourable Prime Minister Trudeau and the Provincial Premier have been failures. I'm not saying it personally towards them because I don't know them. I actually have been on record saying I wish the Prime Minister of this country could succeed. I'm not discussing my politics here. Why? Because if a Prime Minister succeeds, the rest of the country succeeds. So I want my Prime Minister, whomever, to succeed. But Trudeau made a catastrophic mistake with these people in his task force, his COVID task force, because they have failed. Look at where we are. They told you, they locked you down, they closed schools, they masked us for 2 years. They told you take one shot, they said no, take two, and then after two they say, you know what, you need to put the mask back on. And now you're going to University of Western Ontario, they say, well, 2 shots, you need 3. And then with that mask, you still need to social distance. So it is just garbage. They don't know what the hell they're doing. Yeah. The federal government this quick slide. So I have been railing against the cafe latte class, the laptop class we call it, the pinky in the air, sipping the coffee class. Those were the people, the supervisors and the managers in this country and this societies who could have afforded to shelter in place and shield. They could have remote work. But the poor people in our society, often the women in our society, often the minority people, the children in the society, they could not shield. They had to still go out there and face the virus. And when we look at studies, we showed that we looked at the 30 highest income communities in Toronto versus the 30 lowest income communities in Toronto. And we showed that we shifted the burden of infection and the burden of hospitalization and death to the poor in society. And that is the tragedy of COVID. We shifted the burden from the wealthier laptop class to the poorer class. And we must never allow them to lock us down and do this again, because it is the poor in the society that suffers first. And I pull up this chart to show you. This is a UK analysis showing that the managers and directors and senior officials in the United Kingdom and those in professional occupations like lawyers, accountants, and whomever, they have a lower risk of death. They had a lower risk of death than the front-facing people, process, plant, and machine operators, people who work in the society itself. And that's the main message. I wanted to tell you something also, children. In the United States, children get their eyes tested for the first time in school, often, whether rich or poor. It's part of the society. Children get their ears tested for the first time in school. What a lot of this laptop class and people like Doug Ford and all of his employees, his managers, and Prime Minister Trudeau and Fauci and what they did not understand is, in the United States, as an example, children get their only meal in school. Children don't eat breakfast. Most of the poor children, they don't eat dinner. They only eat lunch, and they get it as part of the school feeding program. So when these people closed schools for a year at a time, they didn't know what we knew. Because I was getting the reports with Dr. Atlas coming up from the States. Children were starving. Closing schools starved children in the United States of America for months on end. And nobody stopped to think about the implications of closing schools. Children had no food. And it is such a personal, private issue that you didn't want to, these parents, particularly people living on the margin, they're etching out a living. And Johnny and Susie will become a doctor and lawyer one day, or engineer. But it's nobody's business that Johnny and Susie did not have a laptop, or did not have broadband internet, or a webcam. But by closing schools and doing what we did, you fleshed them out. And you embarrass poor people. You embarrass poor children in Ontario and in parts of Canada to come to the teacher and say, I don't have webcam. My mommy don't have broadband. That is I'm an immigrant. That is a personal issue. That's a catastrophic, demeaning thing for me to come to a stranger to tell you my personal financial circumstance. It's none of your business. But you government officials put people in that situation. You embarrass Johnny. And once little children know Johnny's situation, they insult him daily, and Susie. People didn't understand the catastrophic failure of school closures. We must punish our governments if they do this again. Never allow this again, ever. Look, there's so much to say. I came here with so many slides. Everything was a failure and a lie. They doomed this pandemic response from the start in America, and Canada just followed. This issue about asymptomatic transmission, that was rare. That was a lie. This virus, this asymptomatic transmission was bogus. We studied it, we looked at it. The issue of recurrent infection, that also is a very rare situation. That was a lie used to force you to comply to lockdown and to mask. The issue of the PCR test, we've used our over-cycle test. We told these people, you cycle over 24 cycle count, you're going to be picking up viral dust. You're going to be picking up fragments and non-culturable, non-viable virus. 95% of people who tested positive in Ontario and in Canada were false positive. We know that because they were cycling at 40 and 45. All of those people were not positive people who you took out of circulation. You closed schools. You closed universities wrongfully. We told them about this issue about equal risk of infection. They told us when they locked us down, you know what? We need to lock you down because everybody's at equal risk of severe outcome.
That was a bogus lie. How could Johnny at 10 have the same risk profile as Granny at 85 with 2 underlying medical conditions? That was a lie. We were never at equal risk of outcome. There was a 1,000-fold difference in risk of mortality between an 85-year-old and a 10-year-old. And they knew the data, but they didn't care. They kept locking down more and hardening the lockdowns. There was a lie about no available treatment. That was probably one of the worst lies ever, because we knew that there was early treatment. We knew that we had antivirals and corticosteroids and antiplatelets that sequenced and combined. You could treat Granny, and you could keep Granny in the elderly home, keep her in her private home, because once she touched the emergency room door, her 28-day mortality went up 40%. But they lied, and they prevented the doctors from treating people. Thousands of people in Canada died because they were not provided treatment that was available. Thousands of people died. In the United States, of the 900,000 who died from COVID, we've modeled it recently, McCullough, Risch, etc. We've showed that 850,000 will be alive today. This will go down as one of the greatest blunders and blemishes. And actually, I don't know, doctors in Canada should hang their heads in shame. Scientists, they should hang their heads in shame. They refuse. It's not only what the government's done here. It's not what Trudeau said or Ford said. These doctors should have exercised their clinical judgment and their own decision making and treat your patient. It is your patient. And you knew that these drugs work. You knew these drugs were effective in keeping people alive. And I guess I've written that seminal paper with the 150 studies now. It's courts around the world use it on natural immunity. That actually is my paper. And what we looked at is we brought together about 150 studies to show that it is a bogus lie that vaccinal immunity is superior to natural immunity. And this has been one of the greatest lies perpetrated on the Canadian population and the American and UK and global population. There is no condition under which vaccine immunity could supersede natural immunity. And I want to end quickly just to show a couple of slides. I mean, there's so many things that I wanted to talk about. But why we are here? We are here because, forget the other slides, let's focus on this one. We are here because of these vaccine mandates. And people like Brittle, Hodkinson, myself, Dr. Punes, Dr. Braden, we knew that these truckers were using their gut instinct here, but they also their common sense. They're actually smarter than the government public health official. And we decided we're going to put it on the line here again because we get attacked in the media, smeared and slandered. But we know that 100% of the science, 100% is behind the trucker. So we decided we are going to join the trucker. We're not involved in the collecting of the money. We're not involved in the legal side of this. None of that. We are just the scientists. When they need us, they tap us. We will come, we will talk. 100% of the science is behind the trucker. And I need people to understand that. It might have been common sense to them, but they're actually on the scientific right side. And this is Scottish data. This is an example of what we're dealing with these vaccines. We underestimated the capacity of the virus to evolve and adapt to the immune pressure that we place on it when you introduce a suboptimal vaccine. These vaccines are suboptimal in the sense that they do not cut the chain of transmission. And because of that, if you introduce a vaccine, if you mass vaccinate, and you, with ongoing infectious pressure, we are in the midst of a pandemic, with suboptimal mounting immune pressure, you are going to drive natural selection to play a role and drive the emergence of variants, as we have seen with Delta, Omicron, etc. If you want this pandemic to continue for 100 more years with more variants and a potentially lethal one, thank God, so far it's just infectious with Omicron, but if you want to continue this way, let's continue this vaccine program, because this vaccine program has failed. And the truckers are correct. There is no need for a mandate. None. Because there is no difference today between a vaccinated person and an unvaccinated person. And we have the data, and I will show you just one slide. This is Scotland. This is the unvaccinated, this column. This is 1 dose. This is 2 dose, double dose, and this is booster. What does this slide show you in terms of infection after vaccination? Well, it shows you, if you look at the double dosing, the lowest risk of infection after vaccination. Well, in the unvaccinated population has the lowest risk of infection. It's not. It is the unvaccinated person. The infection risk increases as you get increased dosing. And the double dose is the worst situation. And we see it in hospitalization. What we are seeing is the vaccinated person is getting massively infected, harboring massive loads of virus, and is transmitting the virus. It is not the unvaccinated. And the vaccinated person is also ending up in hospital today. So we have a serious problem with these vaccines. The vaccines do not work. The vaccine has failed on Omicron, period. There's no data now showing effectiveness of these vaccines, and they're not properly safe because they were not studied for the duration of time. So I will end by saying it is time for the federal government of Canada to fire everybody in their task force. Yeah. It is time that Doug Ford fire his entire science table. They're inept, they're incompetent, all of them, all. Fire them. Be willing to open up the table and broaden it to people like Dr. Brittle. He's probably the top immunologist, virologist in the world. Dr. Gert van den Bosch, I work with him daily. Dr. Mike Eden, I work with these guys here, Dr. Roger Ottinson. I work with Dr. Robert Malone. Call me, call any of us, bring us to the table. We're going to broaden it for you, and we're going to bring the science. These people have never been contemporary with the science. COVID is over. It is time to declare the pandemic emergency over. Lift the emergency and allow these truckers to exercise the ability to work in Canada and to cross the border, because they are absolutely correct. There's no difference between a vaccinated and an unvaccinated, and you are denying them their dignity, their humanity, and their ability to earn a living. And that's how I'll end today.